Disney World. Disneyland. What happened? So we were going to do an update on measles because it really did have significance for us in terms of this particular outbreak. But I got bumped for Dr. Gallo, so you know. So the bit of good news is that the epidemic is actually, or endemic I should say, has been declared finished. But we thought it would still be interesting for us to talk a little bit about measles. So that we just didn't want to spend, 10, 15 minutes just on measles. I pulled together 5 of the red rash diseases of childhood. And there are implications for you because you can be walking into a call, particular home, and there you will have a child with a rash. So it does behoove us to know what it is that we're looking at, what we're looking for, and what does it really mean as far as protecting you, protecting anybody else. So what I started with is just pulling this together. So what really did happen, we know, all of you did hear, the publicity was tremendous because the significance of the event had very, very broad implications. So what started was the CDC reported this biggest outbreak since about 1996. Over the course of the many years, we've had several different outbreaks. What made this significant was that in 2000, measles was pretty much declared eliminated in the United States. And now look what happened. And we'll discuss why. So measles infected about 129 people in 13 states in 2014, the most in the first 4 months of any year since about 1996. So the Centers for Disease Control have been certainly issuing warnings. How many, would really relate to the adults in the room, how many of you had measles, the disease? So they usually say anybody born prior to 1957, you're late right now. I know. Measles certainly was around, and most of the people really did have it. The vaccine itself came out relatively recently, but just a little bit in the 60s. So what I wanted to do was just as an intro, I might have to introduce you. Is this going to? Hyperlink. I just want the hyperlink. It's just to, again, raise some awareness. No, thanks.
And now, back here to the new warning from the CDC about measles on the march in America. Tonight, we're tracking a surge of cases, outbreaks now in 13 states. California and New York are the hardest hit. The number of cases growing at a pace not seen in nearly 20 years. So how far could this go and how fast? ABC's chief medical editor, Dr. Richard Besser, breaks it down.
High fever, aching eyes, hacking cough, and after a week, every square inch of you covered by red dots. Measles. Tonight the CDC warns it's back and it's spreading. Even doctors don't recognize it.
Most residents who are training have never seen measles.
129 cases so far this year, 58 of them here in California. Last year at this time, just 4. The CDC saying tonight it's the highest number of cases since 1996. It's so contagious, Dr. Mark Sawyer has prepared negative pressure rooms in the ER here in San Diego.
A special filter which takes out any infectious agent.
Behind the outbreak, many unvaccinated travelers bringing measles back after trips to the Philippines where there's an outbreak, and an increasing number of parents who won't vaccinate their children or choose to delay vaccines past the recommended ages.
We're up to 4.5% of our children at kindergarten age who've not had all their vaccines. That's a lot of kids.
Hillary Chambers, with a baby exposed to measles, has something to say to parents who refuse to vaccinate.
That's not fair. It's like you're relying on everybody else to do it for you.
For many pediatricians, it's a hot button issue.
Isn't it a parent's right to vaccinate their child or not vaccinate their child?
Would you send your teen up to drive a car without wearing a seatbelt?
Dr. Richard Besser, ABC News, San Diego, California.
Disneyland calls itself the happiest place on earth, but now it's also.
We don't need that. Okay. So measles has a very interesting history. One of the original identified 6 red rashes. So historically, it goes way back. And there are some statistics relating to the numbers of soldiers that were killed during, or not killed, I should say, that perished in the early wars of the various centuries. Measles was one of the bigger killers. So all these red rash diseases or communicable diseases in children really do have a very negative outcome. The potential for the outcome, of course, can be really devastating. And let me just give you a very interesting case. And this case is going back several years. So it's a woman who came into the emergency room who was 5 or 6 days postpartum. So she delivered at NYU, lived out on Long Island. So several days later, she postpartum developed a fever. And not only that, she developed a rash. So EMS brings the patient into the emergency room. The reason I got paged was that the charge nurse in the ER was going a little bonkers because EMS came in gowned, masked, and gloved. Does anybody want to tell me what the patient looked like? Sitting in her little wheelchair just like this, okay? So the patient did have a fever, patient did have a rash, patient had a runny nose, she had some, certainly a lot of nasal congestion, some conjunctivitis was also noted at the time. So the bottom line was the discussion was focused on a rule-out diagnosis of toxic shock syndrome, which has a similar kind of clinical presentation, and it would be more of a more common complication, say, postpartum. So anyway, you kind of go down there, and measles, in terms of remembering the symptomatology, I always say 3 C's and a K. All right, so your initials there in terms of that presentation, 3 C's. There's cough. Coragia really means a lot of secretions. And that's just that phantom. So the nose is running, they're really kind of goofy. And the conjunctivitis that goes with it. So there's your 3 C's. And then the K, interestingly, taking a tongue blade and looking into the mouth, off to the side, you see these white, and they're called Koplik spots. So very characteristic in its presentation. Okay. And of course, then comes the rash. So obviously, they did want to call dermatology, so with a little bit of humor in Ms. Coleman, it was like, well, why call dermatology? You really want to call, a pediatrician who's actually seen these kinds of diseases. So she was indeed diagnosed. I actually wanted to call Marcus Welby, if anybody knows Marcus Welby. He was on television. So call Marcus Welby to really, do the diagnosis. And she did end up being positive for measles, and that had tremendous ramifications because the complications of measles are very significant. One being encephalitis. People kind of really forget that. The other one being a measles pneumonia. And in the mid-'80s, there was another outbreak of measles in New York City. It was about 1987. And I remember we had a pediatric patient in the pediatric ICU on a ventilator with measles pneumonia. We had the mother in the ICU, the adult unit, with pneumonia. We very interestingly had a 27-year-old surgical residents who developed, and I've only seen this once in my life, in my career, measles hepatitis as a complication of the disease. So the significance is people forget about this and the devastations. And, you know, the outcomes can really be very poor. Complications of encephalitis can lead to, you know, some certain amount of brain damage and some neurologic devastation. These bad pneumonias you really may not recover from. So again, we're certainly all about prevention, and that's what some of the discussion really should focus on as well. So measles itself, the potential for us to really get a call to a patient could have been. Luckily, it didn't occur. We did not have any reported cases in Connecticut as a result of this particular outbreak. So going back to our patient in the emergency room, she really was admitted. She was placed on airborne, very strict airborne isolation. And airborne isolation really means that measles can linger in the room for several hours, unlike droplet. So a lot of the communicable diseases, and we'll talk about strep in a minute too, as a red rash disease, and Coxsackie as well, you know, somebody has to sneeze, cough, in very close proximity, usually less than about 3 feet. And the portal of entry for these viruses, the mucous membrane of the eye, mucous membrane of the nose, or into your mouth. So that's your portal of entry. But thinking about it in terms of droplet, but airborne, you can be walking right into that room, and there it is. Can't you see it? It's out there. All right, it's out there. So measles, official name rubiola is actually the name of the virus itself. Some people call it 14-day measles based on incubation period. Usually they're about a 2-week incubation. The interesting thing about measles, it's one of the few, rubella and rubiola, one of the few red rash diseases that remain communicable once the rash comes out. And a lot of our red rash diseases, once the rash is out, the children are no longer communicable. So like Fifth disease, which we'll discuss, it's 5 of the 6 red rash diseases of childhood. It's not contagious once that rash is there, but measles will remain so. Okay, so making it, significant. So that rash, as you saw in that illustration on Diane Sawyer's the video, the morphology is a little bit different. It's reddish, it can coalesce. And when you take a look, you can see how it will coalesce. So they're really well covered. And, appreciating the significance of that because we're aware. So remember, they're communicable a couple of days before that rash comes out, and they're going to remain communicable after this rash is out for about 4 days or so. And all of that secretions. And you also know that children, especially the young children, really don't wash their hands. They don't use tissues. They just spew. Okay? Little germ fests as they are. So it really becomes important for us. So once again, the significance is based on history. Significance is also based on immunization status. For us, in the hospital settings, might be something we should think about in dealing with pediatric cases as part of the little quick history. Maybe we should ask a parent if the child's immunizations are up to date. Our children here, we have a very high immunization rate, which really is in our favor. What happened in California, especially interesting in the very affluent sections of California, parents could decline immunization based on personal belief. Everybody in all states can decline immunization based on religious belief, but not personal belief, as we have here in Connecticut. And California, as of last week, just passed a law that they cannot, or they can no longer decline vaccine by personal belief. So that really just may help us a little bit in protecting our children. So the devastating outcome, highlighting that, I think you can really well understand. So once again, though, from our perspective, we have to really make sure we know what it is that we are, walking into. A little bit about that history, think about that particular case study. And as I mentioned, we really have had several outbreaks. Previously, the most recent then, back 1996. 1987 was a big one that we had in New York area. So in this particular one, New York did have several. Upstate New York City did have a couple of cases. So measles was identified as number one of these red rash diseases of childhood, and the most significant as far as mode of transmission and complications, and really most serious based on that. There is a very interesting phenomenon as a complication, I'll get all the initials right, SPPE, with encephalitis. There's a real, an interesting pan-sclerosing something encephalitis that's part of measles complication. And this is interesting in that this occurs some 20 years after you've had the measles. So it's not an immediate complication, and it results in some very significant neurologic devastation. So very unusual complication. All right, so a little bit about measles. All right, so very interestingly, how many of you have heard about strep? How many of you had strep? Do you consider strep a red rash disease in childhood? Not really, but how many of you have had strep with a rash? All right, so everybody's had strep pharyngitis, lesion organisms, strep pyogenes, rubate beta hemolytic strep is that nasty little bug. Actually, it's going around right about now in a couple of cases this morning, positive strep. Okay, it's a great masquerader. So one of the things it is associated with a rash. When you get strep with a rash, then we change our diagnosis a little bit to scarlet fever or scarlet fever. So it can be fairly common in its presentation. Strep, the great masquerader, just to give you to make some diagnosis, you can diagnose yourself. Strep gives you a headache, sore throat, and a stomach ache, with or without vomiting, in any order, along with your fever. Most of the time you're going to get fever with this. Some kids are going to puke for a day or two before they come in, before their throat starts to hurt. Some people get the sore throat right away. Some people get the headache for a couple of days. I've gotten strep, and I get a headache for about 2 days before my throat hurts that 800 emotion will take care of. I kind of know. How many of you know how rotten you feel when you have strep? You know how you really feel, and you can probably diagnose yourself. The significance of strep is very interesting. Since 1945, with the advent of penicillin, we can manage it. Strep is very sensitive to penicillin. As a matter of fact, you're no longer communicable within 24 hours from the start of your first dose of amoxicillin. Okay? But how many of you, and I have to ask the adults in this room, how many of you have known perhaps friends growing up that had rheumatic fever, glomerulonephritis, kidney disease? Oh man, come on, Dick, get me out here. Rheumatic fever? Oh, I kind of remember, the advent of antibiotics, we virtually eliminated, rheumatic fever. Strep, the organism, has an affinity to the valves, especially your mitral valves in your heart. And it gets there and it just hangs out, creates vegetation. So in the early days of heart surgery, a lot of people who had valve problems were the result of strep infections when they were children. And some people who are probably now, in their late 60s, 70s, 80s, having renal problems, glomerulonephritis, because strep went after their kidneys as well. So post-strep infections were the problem. So the good news is now we have our antibiotics, we're very rapid as far as diagnosis and management, and we're preventing all these long-term sequela. The good news also is you have a 10-day window to treat a strep before we ever have to worry about the long-range sequela. And that's why we're really not seeing this anymore, because of what we're doing. So our happy folks know. The rash that goes along strep is very characteristic in addition to the symptoms that I mentioned. And it's a sandpapery, very pink, rough rash. Usually starts right about here, then goes down, out, and can go up as well. So it's kind of, as I said, very characteristic. They also get a characteristic strawberry tongue, they call it, and sometimes that peel, that slops off. Another thing, not the tongue, not a lot of it. All right, so that'll slop off a little bit. Post-strep infections too may result in some peeling of the palms of your hands or the soles of your feet. So strep, the great aspirator, can be associated with a rash, and as a result of this, it's an old disease, and it was listed as disease number 2.
So if you have a child that doesn't want to test but of course, with something like strep, that's a really bad idea.
Right, so,
Something long term.
no, it's an excellent question. Actually, you will get over strep, but running the risk perhaps. But in this day and age, with one, say, episode of strep, probably not. Statistics are relatively low now. But if you can think, remember, you can have had in those early days multiple episodes of strep with never ever being treated that resulted in your life. So it's probably not as common for one run of untreated strep. But the potential, yeah, is there. Very interesting. I wanted to, just last night, yesterday, had three and a half, maybe she was 4-year-old Down syndrome. Came into the office. I had seen the sibling in the morning who was 16-ish, an old, teenager. Obviously, she was positive for strep. In the afternoon, the parents brought the little one in, probably I guess 4. Down syndrome. We cultured her. She's positive for strep. And the parents actually talked to us. It's hard to even feed her in general. She's actually a very low functioning child with Down syndrome. And she doesn't take medicine. She barely takes food. So what were we going to do? We actually were able to give, strep is available. It was kind of a very interesting scene. Bicillin, it's like glue, it's thick. And we actually had to send the parents up to Greaves. Greaves got it for us. They brought it back. We gave the kid this shot. It's a one-shot deal, for that. So if anybody, that's your alternative. You want to take your medicine? We got one other shot for you. Yeah. So actually, it can be done. So kind of interesting. So what about strep with our rash, scarlet fever, scarlatina? It's called, and you can see now it's kind of fine. And as I said, if you rub your hands along it, it feels like sandpaper. Maybe that's just a little bit different. Oh, Chris, we do that when I was okay. As I mentioned, remember the great masquerader, fever, sore throat, the white shoulder tongue, nothing can get through it. So the associated symptomatology including the headache and the stomach ache as well. I didn't order these and name them this way. This is actually the way these diseases were identified and described historically. So this is going way back in history. All right, so this one is rubella. Okay, and anybody ever hear the word German measles? All right, so it's 3-day measles. So it actually is a shorter version, not as communicable, but it has a very interesting set of complications. Why is it very important for young women today to be immunized against rubella? Complications associated with blindness, deafness, rubella syndrome, and mental retardation. Okay, so let's talk about rubella. Also, obviously, rash, starts, more face goes down and goes out. Last 1 to 3 days, it'll kind of go away the same way. Okay, it'll leave the disperse and go away that way. They also may peel. Okay? Particular identified distortion spot, little up in the mouth and up on the palate, you can see these little dots. But I haven't seen a case of rubella in ever. I mean, forever. I've seen cases of measles, haven't seen, rubella. The interesting thing is, when I was in high school, I babysat her child with rubella syndrome. She was deaf, she was blind, and the mother had rubella during pregnancy. And that's the devastation associated with rubella. So we do immunize today, and what you're getting is your measles, mumps, and rubella vaccines as that permanent one. Not as bright and vivid as your rash of rubella. Okay, so we'll say not as bright as vivid, the description that we saw, or the picture that we saw of measles is really, incredible. This seems a little bit less in the morphology of the macules and the papules. So rubella syndrome, what it does, congenital cataracts, which results in blindness. Some often have paper-ductus or so there's a cardiac anomaly associated with it as well. And microcephaly of the changes in the developing neurologic system will also result in a small brain, and deafness kind of goes along with that. So rubella syndrome is certainly seen. They get a lot of lymph nodes all over the place. Anything that you really know is they can get these swollen lymph nodes prior to the appearance of this rash. And rubella also does remain communicable for several days after the appearance of the rash. But remember, it's a 3-day rash, so communicability isn't as great, and usually communicable about 24 hours prior to the start of that. Okay, so we so measles and rubella is very significant strep with the rash. Number 4 on this list doesn't exist anymore. It was called Philippian-Dukes disease. So it's kind of like, gee, what is this? Okay. So now what we think over the years is in the category of these enteroviruses or epiviruses. Today, most of us know it as Coxsackie. Anybody know Coxsackie? Anybody heard of Coxsackie? In September. But you can get it again. It's primary, and it's now. This is the season for Coxsackie. All right. So Coxsackie. Anybody know? Anybody go up the thruway, the New York State thruway around Albany? You ever seen Coxsackie, New York? That's where it was first identified and described. So Coxsackie. So okay, kind of interesting. So just a little bit about Coxsackie, or I should let Ellie tell you, since she had it most recently. Okay, Ellie, tell us about it.
Well, I had a lot of red dots on my face, it was also my throat. I don't know if this is normal, but it felt like super close to my right chest, and stuff was very painful. And it kind of felt like strep throat became a
Very often the presentation is very much like a strep, because what Ellie is describing was also called trench mouth or hand foot mouth disease. All right? Hoof and mouth, right? There you go. You can put it in there. You have a hoof, that's a hoof and mouth. All right? So very characteristically, viral etiology. And it does start with a kind of a rotten sore throat. You look at the throat, it's very red, but it's got white little ulcers in it. And then on the hands, starts with red dots, can be on the dorsum of the hands, dorsum of the feet. Also, it can, in the little kids, the rash can climb up the extremities. It's very interesting. The only red rash disease of childhood that starts in the extremities. Every other red rash disease of childhood starts in the trunk and goes up, down, and down. This one starts in the extremities and goes up, usually stops around the butt, if you're gonna get, very significant rash. Going along with this is really very high fevers. These kids run 104 fevers in 4 to 5 days. And the treatment is obviously fever and pain management, because as you said, you have a rotten sore throat. So we have a toddler, it's really a disease of toddlerhood. She must have been hanging around with the kids. Okay, there you go. And it really is about, pain management, making sure they're drinking. These kids can end up in hospitals only because they don't drink, they get dry. All right, so there you can see some of the little spots on the hands, and some can be on the outside of the mouth too as well. Actually, so I'm gonna have some okay? Fevers, running vomiting, diarrhea, phobia. A little of that can go with it, but for the most part, those are your major distinguishing, features there. All right, the fifth disease. How many of you have ever heard about fifth disease? Yeah, you can see my life. Didn't tell me you had that too. You may come on up here and sit right down. We have a clinical case study with Mr. Coleman on the other side. Okay. Oh, no, when did you have fifths? Oh, 8th grade, so she remembers. Anybody else have fifth disease? Oh, all right, Arthur. Okay. All right, not to embarrass Ellie all the time. What do you remember?
I had like the red patches on my arms,
Okay.
my legs too. Can't remember.
All right.
It was a long time ago.
Okay, what do you remember?
I'm not really sure. I feel like I learned a lot about it. It's just that it's like
Yes, that's what's called the slap cheeks. Slap cheeks. Okay. And the very interesting thing I remember in about 1996, 8, there was a lot of hype about fifth disease. And the reason being that fifth disease, if you had it as a woman who was pregnant, it was associated with a significant degree of spontaneous miscarriage. So when you think about teachers, how old are a lot of teachers? There are a lot of young women of childbearing age in these elementary schools. So what was happening, there's an outbreak of fifths, and you see all these little kids with these little pink cheeks sitting there, and you kind of get a lacy rash, as Arthur was saying. Usually we look on the internal surface, and also it can be on the legs. It usually spares most of the rest of the body, all right? And so what happened, there's all this hype now about it. These teachers are going crazy, and they're all worried because what they know about it, gee, if I get pregnant and I get fifths, there's a potential for me to have a miscarriage. So the press, really got a hold of it, and it's all about this fifth disease, and isn't this terrible? And, in terms of research, the statistic is less than 1% association. If a pregnancy goes to term, there's no complications like with German measles. Those pregnancies goes to term, you've got running the risk of all those terrible sequelae associated with German measles. The virus was only recently identified in the 90s, and it's human parvovirus B19. Adults can get fifths, but it doesn't manifest the same way. Most of the time, what young adults and adults get would be a lot of kind of joint aches that are really not Lyme. So you think about parvovirus. That's the culprit, which is different from the canine parvovirus. So this is your human parvovirus, B19. The little mnemonic that I always speak about, fifths, how do you spell fifths? F-I-F-T-H. Flushed in face, though healthy. Okay? And that's kind of how these kids present. They're not sick. They just kind of look funny. I remember, I feel bad for my own daughter one time. I don't know, we belonged to Middlesex. She was a swimmer, and she was little, And I look, and she's got these little pink cheeks. And I'm going, man, did you put on sunscreen today? Mommy, yes, I swear I went on the sunscreen. Okay. And so like the next day, there, these little pink cheeks are there, and I'm going, are you sure you're fake? It's with the feather something. I swear, and I put it on when I come in and out of the water. So then what happened, the sun begins to set, and it changed the lighting. And then I look at her, and there she has that old, lacy little, whoops. So I yelled at the poor kid 3 days in a row for not using sunscreen, when in fact she really had foot disease, so I'm not perfect. I also sent my son to school with conjunctivitis, so that's all I do. A little embarrassing, I got a call from Joanne Eckstein and told me, conjunctivitis. Who looks at your kid's eyes in the morning? You know, do you ever? I mean, you probably don't even open your eyes in the morning. You know, so I mean, come on. Both communicability, really a disease in little kids, does not have any kind of significance of measles. So that's what we're really concerned about. You know, measles is a big one for us. We really contain rubella. The vaccine is contained rubella. Okay? And there's a little bit of disease. And then if you look closely, that little rash that you can sometimes see, if you touch it, it's actually very flat. And it really is not always that obvious to see. You really have to look at it in different lighting. Sometimes you see in cases it's a little bit more, little red cheeks. Yeah.
Will that lacy on the arm always appear? I mean, my daughter's cheeks always.
And the lacy, that lacy will last for a couple of months. And with the ultraviolet light and sun exposure, it'll become more pronounced. So it'll last for a couple of months actually. But she may have just kids that just have this, you know, little rosy cheeks. But remember, flushed in face, go healthy, it's going to resolve itself viral anyway. All right, what else do we have to see? That again, it's flat when you touch it. Lacy kind of network, and that's a more significant picture, a more significant rash. Most of the time it's not. Sixth disease, actually we had a case of this, it's sort of going around now. And this is a case you may get called for. So you get to the house, this is sixth disease, and this is called actually roseola. So these kids run a temp 104 for about 3 days in a row. Down comes the temp, out comes the rash. So they too are no longer communicable at this particular point in time. So once again, it's very benign. There's nothing else. Just kind of goes away on its own. Communicability, of course, you're really not at risk. Most of us have already had all of these things way back when these viral things. Okay? So sixth disease, these are the other names for it, those are all examples. It was newly identified as human herpes virus number 6, and they've only, in the late 90s, they identified the actual virus. It's been around for a long, long time. You can see it's in the original 6. These red rash diseases, before they really had their names, were just numbers. That's where that comes from. Usually a fading rash. A lot of these rashes will just fade as that virus leaves your body. You know, so it'll stay and that doesn't resolve. Let's see, anything else about those red rashes? Okay. A little bit about rhodiola, relatively benign. Doesn't have much significance for us. Okay. Any particular questions? I want to end with this, just in terms of talk. One second, then Christian, and I'll give you the clue. The good news is these red rash diseases in childhood really don't have the implications that they did in the past. We still know about measles. We know about rubella. The devastation that can be associated with measles were illustrated in a couple of our cases. Measles, mumps, and rubella, the vaccine is about 97% effective. It's given as a 3-in-1. The first vaccine they were produced separately. Measles, we gave it at 9 months of age, came out in 1963. Okay, mumps came along with it as well, was given 6 weeks after that. 6 weeks after mumps, we gave rubella. So the vaccines came out. There were 2 types that came out, 1963 to 1966. The 2 types were out. One of them proved to be the Edmonton strain, and I can't remember the other one. One proved not to be immunogenic, so there was a lot of vaccine failure. The other one was successful. So one was pulled from the market back in 1966. And then we started to, really, routinely give it, and we were quite successful. But then we began to notice some outbreaks. Why were college kids getting measles? They're going off to college, and you hear about these outbreaks. Well, then we realized there was some vaccine failure, or immunity began to wane. So what happened? The CDC, or the Immunization Practices Committee out of the CDC, revised it, and now we changed the time we gave it. We gave it very early. Now we give it between 12 and 15 months. We used to give it around 9 months of age. Then we now boost kids. Will we end up, or I should say, you all had 2 doses of measles vaccine, measles, mumps, rubella vaccine. The second one you got prior to kindergarten entry. Will we eventually see a 3rd booster reline, depending upon how we do with these other outbreaks? Because some of those kids, interestingly, in that California, a couple of them were immunized. But when the virulence increases and it gets, spread around so quickly, as it did, sometimes our vaccine effectiveness have been lessened. Could be just you, the individual, not so much in terms of a vaccine failure. So we give it with measles, we give it, mumps is in there with it. Mumps have been contained, and they always choose to give mumps. If we're going to boost or prevent in terms of measles, we'll always do mumps. Well, here we thought mumps had been contained. And mumps actually is probably one of the more serious ones, because it can render young men sterile. So now, look what happened. Anybody remember this? Yeah, this was just February. So in terms of immunizations, we have to keep everyone. Whoops.
Can I squeeze back?
Just that what I wanted to do was just also identify just the significance of what it is that we do and why immunizations become really very important.
Hitting the NHL hard. More than a dozen players and referees sick right now, and fears that it could spread. The Pittsburgh Pens' Bo Bennett visited 6 kids at a children's hospital last week, and he is now suspected of having the virus. ABC's Lindsay Janice is here, has the latest for us. Good morning, Lindsay.
Good morning, Robin. Once mumps invades a locker room, it finds a fertile breeding ground, and the NHL is reeling from this latest outbreak. They are among the toughest athletes in the world. But this morning, the National Hockey League is scrambling to stop the outbreak of a disease more common in small children. Up to 20 NHL players from the New York Rangers, Anaheim Ducks, and Minnesota Wild. Just some of the teams whose players diagnosed with the mumps. League star and Pittsburgh Penguins captain Sidney Crosby appeared in the locker room with a swollen face, a telltale sign of the disease.
Yeah, feel good.
He tested positive. Teammate Bo Bennett, the latest player suspected of having the virus. The news comes just days after Bennett and several other Penguins players visited the Children's Hospital of Pittsburgh to spread some Christmas cheer. Ooh, look at the teddy bear. In a statement to ABC News, the Children's Hospital says they will be placing patients and families who visited with Bo who had not received their age-appropriate doses of mumps vaccine in isolation and will be monitoring them for symptoms of mumps.
If you have a child with an immune problem or a child with cancer, they're at greater risk of having severe infection from the mumps.
Mumps can cause headaches, fatigue, and loss of appetite. The disease nearly eradicated in 1967, but made a reemergence in 2000.
One person with mumps can infect 10 others, so it's a scary situation for the NHL. Also, the incubation period is 2 to 3 weeks, so doctors are saying it's going to take a long time to know when this is over.
Got to keep that one in mind. All right, Lindsay, thank you.
All right, so keep that in mind. And they can be out and about town, so some vigilance. No. You know what's interesting? You see what's missing in the historical diseases that I just mentioned? Oh, only because I chose it. Well, no, smallpox and and it really wasn't one of the original 6 diseases. But anyway, the question is, if for those of us who really had those diseases, we do have lifetime immunity. And that's a little bit of a good thing. One of the things, just for general information, if you've had chickenpox and you were under the age of 1 and you had less than 12 lesions, it felt that you didn't get enough immunity from that. And you do have a risk of getting that particular disease again. But most of the confirmed lifetime immunity on us. All right, any questions? So, I know, we keep trying, right? Everybody sick, you know? Hold up your hand. Anybody with a diagnosis for Coleman's rash? He's not sick. What was that?
No, only
Oh, I didn't hear it.
only corona surface. Corona surface swab the next.
All right, any other questions?